Welcome to Schein Chats. Dr. Sata, what a pleasure to be here with you. My name is Jennifer Kim Field. I'm the Chief Sustainability Officer for Henry Schein. And the two of us are co-chairs of the Give Kids a Smile National Advisory Committee. And we've been the co-chairs for the past, year and a half. And I think we complement each other's expertise and experiences so well. And while we live on opposite coasts, you're in California, I'm in New York, we've gotten to spend so much time together over the past couple of months. More recently in Washington, D.C. to kick off the Give Kids a Smile program at the Howard University College of Dentistry. It was so fun to be there with you. What a successful event. It's been 22 years of the program with the ADA Foundation, and we recognize the clear impact it has on children receiving the care, but also the oral health professionals who volunteer, especially dental students. So, Megha, I'm excited to hear your perspective as a provider and explore the benefits of this program. So can you tell us a little bit about what motivates your passion for this program?
I've always been passionate about health equity, especially when it comes to children. And I think Give Kids a Smile is sort of a creative approach to address oral health disparities. But there is definitely a more personal story for me. I have 3 daughters, and when my oldest daughter was born, she was born with some health issues. And it wasn't lost on me how lucky and fortunate we were as a family to have easy access to really good health care. And so when I think about mothers who are trying to do the best for their children, or parents trying to do the best for their children, it breaks my heart to think that they don't have access to something as simple as a dentist. And, that could be because they're underinsured or they have no insurance at all. It could be that they don't have the education. It could be where they're located. So I think Give Kids a Smile is a creative approach to get people in the door and help them find a dental home.
That's fantastic. So what do you think, let's speak to that. Why do you think it's so important for the oral health overall? And can you talk a little bit about sort of the advantages or opportunities for those that are providing the care for Give Kids a Smile? So those could be dental students like we saw at Howard University. They could be oral health professionals as well. Talk to us a little bit about that.
Sure. So oral health overall, the good news is we are making strides in lowering dental decay, which is still the most common chronic childhood disease. Second is asthma, but dental decay is still first. And it's still one of the leading causes of school absences. So addressing oral health is so important. And what we've learned is that kids that receive the age 1 dental visit and receive those preventative visits early on are sometimes 40% less likely to have dental decay later in life. So educating students is so important, and teaching them that we need to get to kids by the age of 1 to educate their parents is so important. When I go to these dental schools that are doing programs, it's often a core memory for these students. And I just feel good knowing that because it was so impactful in their educational career, that they're more likely to get involved in the future.
That makes sense. You yourself have hosted many Give Kids a Smile events throughout the year. Is there one memorable moment that you can recount that makes you do it every year, year over year? And I believe you're also a Give Kids a Smile ambassador as well.
Yes. So actually, my first year being ambassador was the year that my oldest daughter was born. I was coordinating the event while I was pregnant. So it was ironic. But this, like about 2 years ago or a year ago, when we did our first event post-COVID, I was talking to one of the fathers that brought 3 of his children in. And one of his sons was autistic with some health issues. And so during COVID, they really locked down. And the dad had also lost his job at that time and couldn't get on the Medi-Cal program, which is our Medicaid program in the state of California. So when I asked him, if this really made a difference for him, he was in tears. And I think for him, just being able to provide for his children without the worry of having to break the bank, because I think we probably did $2,000 worth of work for him and his family that day alone was just very special. It really was eye-opening on the impact that these kind of events can have in families' lives.
Excellent. And what do you see for the future of Give Kids a Smile? It's been around for 22 years. You're an example of one event that happens out of thousands across the country. What does the future hold?
So, it is a very well-established program, and we're able to provide resources for all of our coordinators, healthcare providers that want to take part. And what we see is that we can increase the impact by doing things like building partnerships. So partnering with companies like Henry Schein, but also partnering with community health centers to make sure that these children have a place afterwards to go, linking programs with communities of children that are underserved. A lot of times, private dentists want to take part, but they don't know how to access those communities. So linking them. And I think, Jen, at one of our meetings, you said the ADA is a hub, and it really is. So we're trying to build on that. We're also trying to make sure that every dental school builds this program into their curriculum. And lastly, we are trying to make sure that we are getting better about telling our story. A lot of people don't know what Give Kids a Smile is about. They think that it's just an event every year, but really it's a whole program. And the ADA Foundation has resources, educational resources. And so we're just trying to increase the impact and make sure we focus on getting kids that continuity of care that they deserve.
What steps can people take then in the oral health community to participate more? You talked a little bit about partnerships and things like that, but what are some actions that folks can take if they want to help us expand and make that greater impact that you were just talking about?
Simply just get involved. I mean, I think that they can get involved by volunteering with a program, starting their own program. There are so many resources online to make it easy for dentists and for any type of volunteer. Really, you don't have to be a dentist. You don't even have to be in the dental profession. You can be interested in healthcare. And then spread the word. I think the more people know about what the ultimate goal is for Give Kids a Smile, the better. And lastly, dentists need to start seeing children by the age 1 dental visit. I know that's kind of tangential to what we're talking about, but that's an easy one. And we provide so many resources to teach them how to do that. But I think simply just getting involved is the key.
That's fantastic. Yes, you can go to the ADA Foundation website, check out the Give Kids a Smile page and learn more. So thank you for all you do, Dr. Sata, in advancing health equity and for the children and for your incredible partnership. I'm so honored and thankful to have you as a co-chair for the National Advisory Committee. And thanks again for joining us on Schein Chats.